My name is Dr. J, and I'm the founder of Generational Health. I want to thank each and every one of you for taking out the time to join us today as we build generational health. Generational Health was founded to raise awareness about various health conditions that unfortunately affect our community at disproportionate rates. Unfortunately, I lost 5 family members last year to what many of us healthcare professionals would deem preventable causes. And because of this, I was inspired to launch a healthcare series to educate in effort to prevent other families from experiencing the pain that my family endured last year. With the help of my colleagues and friends, we did just that, as it would present today. It's believed that when one knows better, they do better. That being said, it's Generational Health's team mission and passion to make sure our community is educated and well informed. It's time that we put our lives into our own hands as we preserve what is essentially the most valuable currency, being our health. It's my pleasure to welcome this month's speaker and co-founders, Dr. Kyshari McCullough and student Dr. Alicia Rodgers, as they discuss skin protection in the sun. If you are live with us today, I do welcome and strongly encourage you to utilize the chat feature for questions, comments at any time throughout this conversation, and we can address them as we go on. Without further ado, I will hand it over to this month's speakers.
Let me make sure. Okay. Hi, everyone. My name is Dr. Kyshari McCullough. My pronouns are she and her. And the co-speaker of this presentation is student Dr. Alicia Rodgers. Tonight, we'll be discussing safety for summer activities for kids and skincare for African Americans. I'll tell you all a little bit about me, and then Alicia will share a little bit about her. A little bit about me includes that I recently graduated from Ohio University, and I am currently working as a pediatric intern at the University of Chicago. My passion for this work here that we do at Generational Health includes being a bridge from the medical community to Black families and Black communities. The way in which I hope to do that is through educating and healing Black children. Now I'll give student Dr. Rodgers the chance to introduce herself.
Thank you, Dr. McCullough. Isn't that fun to say?
It's weird.
So as she mentioned, my name is Alicia Rodgers. I also use she, her pronouns. And I am a fourth-year medical student at Ohio University, the DO program that is there. I'm privileged to be a part of Generational Health, and I'm so thankful for Dr. Ford bringing me onto the team and to work with a really great group of individuals who are really passionate about educating our communities of color. And part of my why in being here is specifically for that, to promote education, to empower individuals to live their healthiest and best selves. So I hope to be like Dr. McCullough in a year, also as a pediatric intern, which I'll be applying to following my last year of medical school.
Okay, so can you advance the slides for me to the summer activities? Also, we worked really hard on this Prezi. Okay, so I will start by going over 3 different common summer activities, including water safety, transportation like biking and scooters for kids. And then I'll talk a little bit about violence in the summer, and then I'll have a little quiz, and then Alicia will talk about skincare. So first, before we get started, I would like to share a personal story. I don't know much about my Uncle Jeffrey because he passed away when he was 9. The only piece of information that I do have is that he drowned while he was at summer camp. While the details are truly not that important, what is important is that a child passed away from something that was totally preventable. So now I have a question for you all as we move forward. Do you all think it's true or false that Black children are at a higher risk for drowning? As the answer comes up on the slide. You can send it in the chat, or you can share what you think on the mic if you feel called to do that. Just want to give it a second. Thank you to everybody who shared an answer. Yes, the answer is definitely true. The truth is that less children learn to swim than white children. And the factors that are cause of that statistic is that Black children have a lot less access to swimming pools and swimming lessons. And the study that I got this information from, it didn't mention what I'm about to say, so this is my personal opinion, but I also think that the fears of Black parents plays a role in kids not being safe or being able to access swimming lessons. And then I believe there's a piece of uneducation about resources in the communities that play a role as well. So the important piece to kids being able to enjoy water sports in the summer includes, yeah, it's super fun, but it can be a bit of exercise for the kids. So it definitely makes younger kids super tired. And then it is also a chance for kids to socialize pre-COVID, of course, hopefully post-COVID. So it can be really good for the overall development of a child to participate in water sports. I do have a list of resources here, and we'll send out an actual list for you all to access a list of resources. So that includes like Chicago Park districts have free swim lessons. You can still sign up. I think the deadline is the 20th of June, and that's a 10-week course. There are life jackets on Amazon for $12, and that depends on the size of your child. And I did want to mention that life jackets are a lot more important than those floaties that you can place on the kids' arms. The thing with that is that the kids' arms will float, but most of the time in the first couple of years of their life, their head weighs more than their body. So it'll tip over, and that can suffocate them as well. So you want to get the entire life jacket. And then my last bit of advice here is to talk to our kids about why we fear the water and getting over that fear ourselves as parents so that our kids don't inherit those things. Next slide, please. Next, we'll talk about transportation, which is a weird topic to say when I talk about biking, but that's true. Biking, scooters, and skates. Biking is for younger kids and older kids as well, but scooters really for older kids. The benefits of riding around is that it's really fun for kids, right? It kind of makes them seem cool with their friends. It also allows them to socialize and explore their surrounding environments, which is also great for development. Really, really good exercise as well. But it can also be harmful if precautions are not taken. I don't have a statistic for concussions, but I do know that they are less likely to occur and be impactful when a helmet is worn. So I do have a list here of the YMCA, which I looked it up, and they actually give away free helmets on certain days of the year. And then some children's hospitals also give away free helmets to kids that qualify. Stranger danger is also an important thing to be aware of when kids are becoming more mobile. And then broken bones, especially if you have an adventurous male child. So let me make sure. Yes, so I talked about the resources for the helmet, and then just be attentive and aware of where the kids are going, who they're being with, and stuff like that. Next slide. So this next slide, I did want to give a trigger warning because I am going to talk about violence for just a second. I will try to make this very brief but impactful. You can go ahead. So in my mind, there are 3 types of violence in general, but especially towards kids. Violence against yourself, violence with or against others, and then violence occurring in the home that's domestic. Can someone tell me what violence against yourself would look like? you can also put that in the chat or share on the mic. Cutting is definitely one. I'll give that like awkward, what is it, 5 to 8 seconds of silence. Okay, cutting is one that we see often. There's burning as well. And then thoughts or attempts of suicide. Thank you for answering, Dr. J, excuse me. Violence with or against others can include fighting or bullying and gang violence. And then there is domestic abuse, which occurs in the home against kids, and that's emotionally, sexually, or physically. The last bit that I'll share about this is that if these situations apply to you or currently, or if you have been a part of this before, it may be time to think about getting some help. Even if the act has passed, it's really a good idea to unpack that type of stuff. The National Alliance on Mental Illness is a really great resource. It's a really great resource. They provide lots of things, and one of those things include finding counselors in your area that are affordable. The suicide hotline is a number that you're able to call. You can call whenever, 24 hours, there will always be someone to answer. If you're worried about finding an affordable counselor or health insurance, just contact me and I will we can work on helping you get that. And then something parents can do is help teach kids problem-solving skills. And then when possible, find support in your family or friends. And then we'll move on to our quiz. I think it's on the next slide. Okay, perfect. All right, you can just type these in the chat, true or false. You can type T or F. Are Black kids more likely, what does this say? More Black kids know how to swim than white kids. Is that true or false? Right, definitely false. Cool. Some hospitals give out free helmets. Is that true or false? Good job, everybody. Everybody's listening. And then when you're in trouble, there's always someone to listen. Is that true or false? Also true. Does anyone have any questions for me before we move on to skincare?
I know you mentioned resources for mental health in general. Was that specific to children, or is that for everybody? Is there a place that's
a really good question.
Easily accessible for children that children can remember?
That's a good part. No, I didn't actually find any resources that are specific to kids. I think that the National Alliance on Mental Illness is like teenager and up. I don't know what that specific age range cutoff is, but I will definitely find resources for younger kids that are able to access. Thank you for bringing that up.
Sure, and I think it's also important, if you don't mind me, just like,
go ahead.
It's important to know that you can go to your pediatrician if you are concerned about your children's mental health, and they can either, help you themselves, or they can direct you to other resources that can help children. But definitely utilize pediatricians.
Any other questions for Dr. McCullough before we transition? Okay. So we are going to move on and talk a bit about the skin, so keeping fully with the summer theme. And we're going to kind of just jump into it. So you can see here on the screen, I have 3 true false questions, and I want these to kind of spark hopefully some conversation, and then I'll give some context to what we find out the answers are. So again, kind of going with the true or false, let's start with this first one up here. So true or false, people of color do not need to wear skin protection because they do not sunburn. So again, you can type in the chat if you think this is true or false, or you can do the reactions where you give a thumbs up or a thumbs down. Thumbs up for true, down for false. So let's see what we have. This is great. This is great. You all are getting the correct answer. So yes, this is false, absolutely false. So I bring up this point because this is something I've heard a lot in communities of color, thinking that we don't sunburn. And I will say as my own personal experience, I think I can count on one hand. Nonetheless, when I burned, it was not fun and it hurt. And it's very uncomfortable and it is skin damage. So the way this happens is that the more that you are exposed to direct sunlight, and especially when it's unprotected, that increases the likelihood of sunburn. And this occurs in all skin types. Okay. So we'll go to question 2. So true or false, SPF that you read like on the sunscreen bottles stands for standard protective force. So take your best guess. And I have to admit, I did not know the actual answer to this until I was preparing for this presentation.
So the answer is false, is what you're saying.
That's right. So yeah, so I saw a lot of truths. I made this up. So it's false. So actually SPF stands for our natural skin protective factor. And so what the SPF is telling us is what determines the risk of sunburn. And that's related to unprotected skin versus, that should say protected, but the opposite of unprotected, so protected. Anyway, sorry, my own semantics. So again, this is related to what our skin has the ability to protect itself. And I'll get a bit more into what that protection looks like, what that means. But essentially for persons of color, we naturally produce more melanin, which has a natural protection from radiation. But the thing that's important to know is that what we're protecting against with sunscreen is against solar energy. So not specific to the amount of time you're spending in the sun. So I have on here the example of 9 a.m. versus 1 p.m. So at 9 a.m., that's when the sun is not quite at its peak. And this is in most temperate zones. And for the majority of us streaming in from Ohio and pretty much the same kind of temperate zones of the globe, 9 a.m. is when the sun is still very low. But once we go into that 10 a.m. to 2 p.m. and sometimes even to 4 p.m. in the afternoon, the sun is at its peak height, and that's where we're getting direct sunlight. So being in the sun at 9 a.m. will be comparable. So spending an hour in the sun at 9 a.m. versus spending like 15 minutes in the sun at 1 p.m. will have the same effect and same risk of sunburn. So it's not, again, dependent on time, but it's based on the amount of radiation or energy coming from the sun to then increase the risk of burning. All right. Also, please feel free to throw questions in the chat, but thank you so much for participating. So we'll go to this last question here. So true or false, UV radiation can cause skin damage and lead to cancer. Great. I realized as I was talking at that last point, I a little bit gave it away, but nonetheless, I assume that this is a little bit probably more common knowledge, so that's great. So yes, this is true. So as I mentioned, all bodies naturally produce melanin, and these come from specific cells that exist in our skin. For people of color, we have more melanocytes. The more melanocytes you have, the more of the protein that it produces, which is melanin. And what melanin does is it starts to absorb radiation from the sun. So it helps block against UV rays that are coming from the sun. That's the radiation that you hear people talking about. So for even the darkest of skin, they can produce up to about SPF 13. However, that is still not sufficient. And the problem that happens is that without the additional barrier of sunscreen, that radiation can lead to damage of cells. So the damage of cells can cause uncontrolled growth. But then it's like, Alicia, if you're making more cells, isn't that more protection? Well, good question, but not quite. The problem is that these cells are growing unregulated. And without getting into all the nuances of basic science, those cells, while they're making more, they're not being produced with the same function and capability that they should be. And so that's what can lead to, in effect, those cells going from just being tumors. So that could be either okay or not okay. And then they can become more harmful. And when they're harmful, that's what we call malignant. So they're doing less help and causing more harm in the end. Okay. So now that we've kind of covered some basics of the skin, we'll go into a few more points that I really want to highlight. And I see a question in the chat. Speaking of basic science, bringing it back.
So, okay, I just wanted to include a plug about taking vitamin D. I didn't know if you wanted to talk about that or not.
Oh, sure. Yes. So thank you for bringing this up. So in spite of all that we're saying and maybe the way that it sounds at the moment, the sun is not bad. It's just that we have to take it in the appropriate doses and with the appropriate protection. And one of the reasons the sun is not bad, but good for us, is that it helps us produce naturally vitamin D. And so vitamin D is a vitamin that we need. Either we intake it through our food, we get it through the sun, things like that. The risk that we have, and again, kind of talking about where we are, like in terms of geographic regions in the globe, we're in an area where, so again, not like at the equator where the peak of the sun kind of hits more equally throughout the day than kind of those peak times. We're in the area where, because we have a true 4 seasons, we get less vitamin D. The other thing too is for people who have more melanin, you produce less vitamin D. And so typically you'll find in people of color that we have lower vitamin D levels, but also just being people in this geographic zone, it's important that we probably need to supplement the amount of vitamin D. Now, this is a little caveat. This is not medical advice. This is medical recommendations. So conversation starters with your physician or healthcare provider about if you need to do an advanced supplement. But if you're taking something like a multivitamin that includes vitamin D, typically, that is usually a sufficient coverage to help support healthy body balance of vitamins. Do you want to add anything else?
No, that was beautiful.
Thank you. Oh, you got me on the spot with that one. That was good.
You did great.
Thank you. Okay, so a few more true false questions to highlight some other important points about protecting our skin. So this one up here. So true or false, Black people are less likely to die of skin cancer than white people. Okay. So I'm seeing a lot of falses. Great. So I'm glad that you all are catching this point. Yes. So in fact, Black people, and I'll even open it up a little bit more to persons of color, we are more likely to die of skin cancer. Now, I'm curious if anybody would like to come on the mic, or you can also type it in the chat. Why do you think that Black folks are more likely to die than white people? So underdiagnosed, That's one thing I see.
Could it be the lack of vitamin D?
Okay, lack of vitamin D. I'll admit that's one that I'm not specifically sure on, but it's a good point. So I'm seeing undertreated and underdiagnosed, underutilization of healthcare resources. Yeah, great. So, and let's see, lack of education on when to be seen. We don't wear sunscreen, thank you. Yeah, very good. So you all are kind of hitting like the main ideas, the main concepts. So this is actually kind of in follow-up from a study that came out of the University of Cincinnati, and they did look more specifically at Black people versus white people and the rates of diagnosis of skin cancer. And what they found is that people of color are diagnosed at lesser rates, but present at the time where the cancer stages have progressed. And to the point where these cancers become more difficult to treat, there are other complications related to the cancer that has been found. And it becomes more difficult to support persons of color with what they need had the cancer been recognized earlier. And so, yes, so what are the different reasons that that happens? Why are people showing up to clinic a lot later, or these cancers are being found a lot later? And this does go back to a lot of the comments that you all have put in the chat. So things that we can do naturally every day, like wearing sunscreen is a big important part, but also education. So for example, until I got to medical school and really until I started looking on my own, these were things that I did not know necessarily about protecting my skin. And as well, you know, utilization of healthcare resources is an important one. Are these conversations that are happening in the clinic? Are these things that are talked about at home or in the community? And, you know, how well are we aware of these things as well? Undertreated is another one. So something that we see a lot, and I'll be specific to my medical training. First off, dermatology. So looking at skin is not one of the most common or presented topics that we see. And when we do see them, they're usually on white skin. And the problem with that is that that's not what those cancers or lesions look like on our bodies. So kind of the default images might not be recognized, for example, by a healthcare provider when a patient comes into clinic. And even for something very routine, if you're just looking at the skin, that's something that you could pick up, see right away. So something that's important for us is with the information that we get, that we share it and begin kind of those practices and our own advocating for ourselves. And I'll talk a little bit about what that means. And thank you for bringing up what is dermatology. So that is the study of skin diseases, skin disorders. And so the other thing I do want to bring up about that is that you do not have to see a dermatologist specifically for these lesions to be recognized or even to start the care. This can be done with a primary healthcare provider to initiate that conversation, to recognize if there's anything of concern. And then from there, you can bring in other healthcare players that can best support patient needs. Okay, so I have one more true false question, and then we'll get into some takeaways from all of the conversation. So true or false, sunscreen offers anti-aging properties and reduces skin tone changes. Very good. Yep. So I'm seeing a lot of truths. Oh, I see a false. Okay. A little difference in thought here. So I'm glad I actually saw a little false pop up. And now I have to admit, I don't remember why I put truish, but I put truish. And I think maybe because I was thinking it's a little more like indirect and so much straight on, but that's kind of questionable. So anyway, so this falls more on the side of being true. So the thing that's important to know about this is that the more sun exposure and thinking over a lifetime, it does accelerate skin changes, and it can impact like different tones that we see in skin. So one of the things biggest being like hardening of skin, but you can also see wrinkles, fine lines, and then photo aging. And that might be more for people who have lighter skin, but usually in darker tones, a concern related to the sun is hyperpigmentation. And so I have this picture here of what I believe is a woman, and she has what is called melasma. Something to know about that is this can happen commonly for those who are pregnant, and hyperpigmentation is one of the signs of that, and melasma is one of the presentations. Also, it's what you see like when the belly starts to grow outward, and kind of that midline darkening happens as well, a related process. But melasma or freckling, which I think you all know what that is, that can also happen with increased sun exposure, usually excessive sun exposure. So something too that we can be aware of. Okay. So some final points to wrap up. And we'll tie back in, the kids that we started with that Dr. Kyshari talked about. The really important thing that if we can bring all age groups together and talk about is establish habits early. And it's not too late to get into the routine of having these healthy behaviors related to protecting our skin. And the reason I really want to emphasize too that starting these habits early, or having these conversations with your kids, promoting this behavior in younger people, is that all of skin changes, all of the impacts that we give onto our skin is all related to the lifetime of skin. So yes, our skin regenerates often. However, the DNA that we continue to share in, like, that our cells collect or recreate in the different cells that they produce and so forth, those mutations can pass. And so the better that we do with protecting our skin, the more that we reduce that risk of causing any mutations that can cause that unregulated cell growth, that can cause tumors that can become cancers. So habits early are super important. And starting now, starting today, starting with the summer now is super important to do. And also with restrictions being lifted, summer being relatively normal to what we're used to, I want to encourage that whenever you're not, in the height of the activity that you're engaging in, whether you're going to the beach or out for like skating and biking, like Kyshari talked about, so forth, go into the shade. I really want to promote that. That's something that we do. And also just covering your skin. So, I know it's hot a lot of the times and we want to like show off and flex and muscles and everything like that, working out, and it's cool. But when we can cover our skin, when we can reduce the amount of sun exposure, that would be really, really important. And if there's anything that you take away from today, please, by all means, wear your sunscreen. When you are wearing sunscreen, the things you want to look for are broad spectrum. So that covers both UVA and UVB rays. And just the thing there is that one is more likely to cause the DNA damage, and the other one is likely to cause sunburn itself. But together, not good. So broad spectrum. You want to have SPF, so skin protective factor, of at least 30. And really going above that isn't crucial, because with SPF 30, you have 97% protection from the rays that will burn and will cause burning and will cause damage. So really important to do. As well, you want something that is water resistant, so it can withstand when we sweat, when we get sprinkled with water, when we hop in a fire hydrant, whatever, to cool off, because it's hot, it's the summer, but we still want to be outside, and we need to get our vitamin D. And then, so this is specific to, and I don't want to get too into the weeds with this one, but really good practice would be to apply sunscreen about 15 to 30 minutes before you go outside. and repeating or reapplying your sunscreen about every 2 hours. And you'll want to do that more often though if you are coming in and out of the water, or if you're like sweating like in a sport where it would cause a lot of runoff. And we have some resources, some recommended products for you to try that have been made by Black women. And so they are tailored towards preventing us from having that, ashen and chalky appearance, but still give all of the benefits that come with broad spectrum SPF 30 water resistant sunscreen. So for us, by us, sunscreen. And that is what I have to share.
You see, I'm not sure if you said it, but we should be wearing sunscreen every single day.
Oh yeah, every day. Every day, even partly cloudy days, the sun is still coming out. It is still touching your skin. So please protect it. Please.
On your face and your neck every day.
Face, neck, and don't forget your feet.
I definitely forget my feet.
And I'll drop the link in the chat, but the resources are set onto ourgenhealth.org, which is our webpage.
Does anyone have any questions? Comments, concerns, gratitude?
Thank you, Dr. McCullough and student Dr. Rodgers. That was a really nice presentation. It was right on time. Oh, my camera's not on, I'm sorry. It was right on time. I learned a lot. I know I'm in the medical field, but I think this was very beneficial for all of us, whether we're healthcare providers or not. So thank you, I appreciate that. And that was definitely a very important topic that is not talked about enough in our community. Right now, I like to hand the mic over to Dr. Motley. She's going to introduce herself because she is July's speaker. So I'll let her discuss a little bit about what she's going to talk about.
Hey family, how y'all doing? My name is Jess Motley. I am a PGY2-ish because I'll be a PGY2 in about a week. That means a second year resident at Grant Family Practice. And next month rather, I want to talk about musculoskeletal injuries and the importance of keeping your body in motion. I have a background in sports medicine, and I hope to pursue that as I further my medical career. And so I see a ton of folks that come into my clinic that I think that there's just some education that could be worth listening to as far as like how do you treat initial injuries? Why is it important to keep our bodies moving? What are red flag symptoms, like symptoms that you should really come see a doctor for, and what those look like. So I hope you guys tune in, and we'll have a great time.
And in addition to Dr. Motley's topic, we have some other exciting topics coming up, such as breastfeeding, inflammation, and hopefully even an herbalist as we discuss holistic medication or treatment. So just stay tuned and stay on the lookout. Look out for our calendar that that should be on our website and that we post on our Instagram. And then also, if you guys have a topic that you would like to suggest, feel free to email us at ourgenerationalhealth@gmail.com. We will be glad and happy to discuss the things that you guys want to learn about, because ultimately this is for you, this is for our community. So thanks again for joining us. I hope everyone has a blessed evening, and we hope to see you next month.